Hi, I'm Dr. Shashidhar. I'm a pediatric ENT consultant and I work with a hospital called Artemis in Gurgaon. I'm going to talk about the common problems in children, the cold, and why it comes again and again, and what we can do about it. It's a very common problem nowadays with children going at daycare and play schools at an early age. And a lot of times we've been told that this is because of the pollution or the allergies or infections from the surroundings. But quite often we miss a very common cause of the cold, which is what we call as adenoids. What are adenoids? Adenoids are these are a small lymphoid tissue, the tissue which makes white blood cells in the body behind the back of the nose. They are normal in children, but sometimes they grow up in size. Like what you see here, if this is the size of the adenoids, which should be there, which is marked in violet, sometimes they grow the bigger circle here, the yellow in the back of the nose, and they block the nose. When this happens, the common symptoms in children are snoring, breathing from mouth, a restless sleep where the child is constantly turning this side and that side trying to get a good position in which he can breathe, some drooling, and some coughing in the night. More often than not, we tend to miss adenoids because we can't see them directly, and we tend to treat these conditions in terms of allergies, bronchitis, and put the child into nebulizations and unnecessary treatments. What I've found in my own experience, that a lot of the kids who have been told they have allergies and they have been told they have bronchitis have actually adenoids. So if your child has recurrent problems of sore throat, breathing difficulties and nose blocks, it's worth getting evaluated for adenoids because the treatment of adenoids is very simple and often very gratifying, which can be done with simple nasal sprays, saline washes, and if it's a severe one, it needs a surgical intervention to open up the nose. Adenoids also cause recurrent ear infections, ear pain, and sometimes they cause decrease in hearing. And decrease in hearing in children is very difficult to catch because the child will not complain that I have decreased hearing. You can only perceive it as sometimes when you call them they don't respond, the grades are falling in school, and when they watch television they tend to raise the volume of the noise. And this helps us to pick up the child to screen for the hearing problems, because when you have adenoids you have a higher chance of getting ear infections and fluid inside the ear, which is called otitis media, which can also be treated in the same lines. Rarely we need to put some grommets or some surgical intervention to drain the fluid out if we are not able to treat it medically. Third problem which I wanted to discuss is allergies in children. Allergies in children can present in a very wide spectrum. Sometimes they present only as cough, sometimes children get rashes on their skin, sometimes they can have allergy to food and recurrent diarrheas and other problems. So allergies in children can be treated quite effectively with medicines, and we have what we call as immunotherapy to detect what the child is allergic to so that we can specifically target that antigen and cure him for the long term. This is now the most gratifying and the latest treatment in allergy called sublingual immunotherapy. With all these new exciting treatments, and if your child is not getting benefit by cold and cough routine treatment, you're free to contact me at 3 Senses ENT Clinic, which is in South City 2 Arcadia, Gurgaon. I'm also available at Artemis hospitals throughout the week except on Sundays. Thank you so much for your time.